The World Health Organization declared the global spread of COVID-19 as a pandemic on March 11, 2020. And since then, the havoc created by this virus still continues. Now, the virus is transmitted primarily through direct or indirect personal contact through an airborne respiratory droplet from an infected person. Now, as much as hand hygiene is essential, so is oral hygiene, as the oral cavity serves as a portal of entry of the virus into the body. Now, the oral cavity has over 7,000 bacterial species and numerous respiratory pathogens. Therefore, a 2021 study suggested that poor oral health can play a part in contracting COVID-19. Now, there are certain standard oral hygiene practices to prevent the COVID-19 infection. First, the members of the same family should not store their toothbrush into a single container, which can be a source of cross-contamination. Second, the tube of the toothpaste has to be separate for every member, as it can also be a source of cross-contamination. Third, it is recommended to disinfect the toothbrush after every single use with an antiseptic mouthwash, preferably a 0.2% povidone iodine. Fourth, the head of the toothbrush has to be stored upwards, which facilitates faster drying and which helps to halt the spread of the microorganisms. Fifth, the toilet serves as a potential viral contamination source. Therefore, the toothbrush and tooth cleaner and other personal fomites has to be stored away from the toilet or at least 1 meter apart. Next, people who have recovered from COVID-19 should discard their toothbrush and the tongue cleaner immediately, as it can be a source of infection for themselves and to other people also. Next, people with any kind of physical dexterity or medically compromised people who are unable to maintain their oral hygiene should seek professional help to maintain their oral health. Next, people who are using powered toothbrushes or oral imitators should switch to manual toothbrushes or disposable interdental cleaning aids, because such products generate a lot of aerosols. So in conclusion, as we are immunologically preparing ourselves to face COVID-19 infection, oral health plays a very important role and it should not be ignored at any cost. And I think that's it for today's video, and I hope this information was useful.